The implant should be inserted just under the skin at the inner side of the non-dominant upper arm, about 8 to 10 centimeters above the medial epicondyle of the humerus, avoiding the sulcus or groove between the biceps and triceps muscles, and the large blood vessels and nerves that lie there in the neurovascular bundle deeper in the subcutaneous tissue. To avoid neural or vascular injury, place the implant subdermally no closer than 8 centimeters from the medial epicondyle and not over the sulcus or groove. Stretch the skin around the insertion site with your thumb and index finger. Puncture the skin with the tip of the needle slightly angled less than 30 degrees. During the entire insertion procedure, you should be able to see the insertion site and the movement of the needle. Lower the applicator to a horizontal position. While lifting the skin, also known as tenting, gently insert the needle. Make sure the needle is inserted to its full length. If the needle is not inserted to its full length, the implant may protrude from the insertion site. Keep the applicator in the same position and unlock the purple slider by pushing it slightly down. Move the slider back until it stops. This will cause the needle to be fully retracted. Have the woman lie on her back with her non-dominant arm flexed at the elbow and externally rotated. Her wrist should be parallel to her ear, or her hand is positioned next to her head. Identify the insertion site, which is at the inner side of the non-dominant upper arm, about 8 to 10 centimeters above the medial epicondyle of the humerus, avoiding the sulcus or groove between the biceps and triceps muscles and the large blood vessels and nerves that lie there in the neurovascular bundle deeper in the subcutaneous tissue. The implant should be inserted subdermally just under the skin. Make 2 marks with the marker, one mark at the insertion site and the second mark a few centimeters above the insertion site. The second mark will be used as a direction guide during the insertion. Clean the insertion site with an antiseptic solution. Anesthetize the insertion area. For example, with an anesthetic spray or by injecting 2 milliliters of 1% lidocaine just under the skin along the planned insertion tunnel. Hold the applicator just above the needle at the textured surface area. Remove the transparent protection cap by sliding it horizontally in the direction of the arrow away from the needle. If the cap does not come off easily, the applicator should not be used. You can see the white implant by looking into the tip of the needle. Do not touch the purple slider until you have fully inserted the needle subdermally, as it will retract the needle and prematurely release the implant from the applicator. With your free hand, stretch the skin around the insertion site with your thumb and index finger. Puncture the skin with the tip of the needle slightly angled less than 30 degrees. It's important that you're in a position during the entire insertion procedure to clearly see the movement of the needle just under the skin. Generally, you can see movement of the needle best if you're seated and looking at the applicator from the side and not from above. Lower the applicator to a horizontal position. While lifting the skin with the tip of the needle, slide the needle to its full length. You may feel slight resistance, but do not use excessive force. If the needle is not inserted to its full length, the implant will not be inserted properly. Keep the applicator in the same position with the needle inserted to its full length. If needed, you may use your free hand to keep the applicator in the same position during this part of the procedure. Unlock the purple slider by pushing it slightly down. Move the purple slider back until it stops. The implant is now in its final subdermal position, and the needle is locked inside the body of the applicator. The applicator can now be removed. If the applicator is not kept in the same position during this procedure, or if the purple slider is not completely moved to the back, the implant will not be inserted properly. To ensure the insertion was performed properly, check to see that the needle is fully retracted into the body of the applicator. Only the purple tip of the obturator should be visible. Place a small adhesive bandage over the insertion site and palpate the implant. Always verify the presence of the implant in the woman's arm immediately after insertion by palpation. By palpating both ends of the implant, you should be able to confirm the presence of the 4-centimeter implant. Until the presence of the implant has been verified by palpation, the woman should be advised to use a non-hormonal contraceptive method, such as condoms. Also request that the woman palpate. If you cannot feel the implant or are in doubt of its presence, check the applicator. The needle should be fully retracted and only the purple tip of the obturator should be visible. Use other methods to confirm the presence of the implant. Given the radiopaque nature of the implant, suitable methods for localization are 2-dimensional X-ray and X-ray computerized tomography, CT scan, ultrasound scanning, USS with a high-frequency linear array transducer, 10 MHz or greater, or magnetic resonance imaging, MRI, may be used. In case these imaging methods fail, it's advised to verify the presence of the implant by measuring the etonogestrel level in a blood sample of the subject. Apply a pressure bandage with sterile gauze to minimize bruising. The woman may remove the pressure bandage after 24 hours. The adhesive bandage covering the insertion site may be removed after 3 to 5 days. Complete the user card and give it to the woman to keep. Also, complete the adhesive labels and affix it to the woman's medical record. The applicator is for single use only and must be adequately disposed of in accordance with local regulations for the handling of biohazardous waste.